Hi everyone, welcome to Raaonline. So coming to the morphology, so it is going to be a diplococci, that is a gram-negative cocci, which is going to be arranged in pairs, and it is going to be one of the sexually transmitted bacterial infection. So when we talk about various sexually transmitted infection, like we have a variety of infection. So we have bacterial infection, we have fungal infection, then we have the parasitic infection, and we have numerous viral infection. So today, like we are going to see only about the bacterial infection, that too only the gram-negative diplococci, that is the Neisseria Gonorrhoeae. So we are going to deal with only the gonococcal infection today. So gonococcal infection, once again, it is going to be transmitted by an organism called Neisseria Gonorrhoeae. So it is a gram-negative cocci which is going to be arranged in pair. So again, the arrangement is very important. So depending upon the plane of division, there is going to be the arrangement. So here it is going to be a gram-negative diplococci, and predominantly it is going to be seen within the cell, that is an intracellular diplococci, and it is going to be a monomorphic one. So whenever like we talk about the organism, like there are like various form like pleomorphic and monomorphic. So here it is going to be a monomorphic diplococci which is going to be arranged within the particular intracellular area. So it is going to be an intracellular gram-negative diplococci. So coming to the virulence. So in order to study about the particular organism, we must know like what are the various virulence factor by which it is going to escape our immune mechanism. So when we talk about the virulence mechanism, so the virulence which is confined to Neisseria gonorrhoeae, it is going to be the pili. So with the help of this pili, so this is the pili. So if you closely see, there is going to be an hair-like projection. So these are the pili. So with the help of these pili, this particular organism is going to go and attach to the uroepithelial cell, and it's going to initiate the pathogenesis. So with the help of pili, it is going to attach to the epithelial cell, and it's going to start or initiate the particular infection. Then coming to the outer membrane protein. So with the help of outer membrane protein, like it is going to escape our immune cell. And we have something called IgA1 protease. So it is going to release the IgA1 protease. So it is going to break the secretory immunity. So there is going to be an immunoglobulin called IgA which is going to line the particular epithelial cell. And what it's going to do is that it is going to produce that particular IgA1, and it's going to bind to that IgA, and it's going to block the mechanism of IgA. So it is going to neutralize the immunoglobulin A, which is going to be seen predominantly in the mucosal area. And there is something called transferrin and binding protein, and there is something called lactoferrin binding protein. So with the help of these protein, so it is going to escape the immune mechanism, and it is going to prevent the phagosome lysosome fusion, and also it is going to and it is also going to inhibit the various complement mediated lysis of the particular bacterium. Now moving on to the clinical features. So whenever like we talk about the sexually transmitted infection, the symptoms and signs are going to correspond to the genital tract. So here the patient may experience something like acute urethritis. So in case of acute urethritis, the patient is going to have a burning micturition, or patient is going to have something like a penile irritation, or the patient is going to have any vaginal discharge. In case if it is going to be the male or female, it's going to be the symptoms going to be different. In case of it is going to be female, it's going to be the vaginal discharge can be there can be fever, and there can be like symptoms and signs which is going to tell about the pelvic inflammatory disease. So this particular organism can cause pelvic inflammatory disease. And in case if it is going to be male, the patient is going to experience painful urination, and the patient is going to have irritation of penile area, and the patient is also going to experience periurethral discharge. So periurethral discharge is commonest finding among the male. And there is also going to be something called sinus formation, which is one of the most common complication of gonococcal urethritis. So here the patient is going to experience something called sinus formation, and there is going to have an urethral, there is going to be a pus discharge from the particular sinus, which is called as water can perineum. And there is something called Fitz-Hugh-Curtis syndrome. If the particular patient who is going to have this kind of illness, if not treated for a longer time, so they are going to develop something called peritonitis along with the perihepatic inflammation. So both of this combined together, so they are called as Fitz-Hugh-Curtis syndrome. Again, this particular thing can be asked in your competitive exam like NEET exam. So there's a terminology called Fitz-Hugh-Curtis syndrome, which is seen in patient who is going to suffer from the infection like Neisseria gonorrhoeae or gonococcal infection. So here the patient is going to have the peritonitis along with perihepatic inflammation. Both of these conditions combine to form the syndrome called Fitz-Hugh-Curtis syndrome. And any neonate who is born to the mother who is going to suffer from this particular infection during the time of birth, so the particular neonate is going to develop a condition called ophthalmia neonatum, where the particular baby is going to suffer from conjunctivitis due to this particular infection, and it's going to have an eye discharge, purulent eye discharge. Again, we will be able to see this particular organism in the eye discharge. And in patient with a certain complement deficiency disorder or primary immunodeficiency disorder, there can be dissemination of this particular organism, which can lead to disseminated Neisseria infection. So now moving on to the complication. So most common complication of this Neisseria infection will be like disseminated Neisseria infection. Most of the time this Neisseria infection is going to get confined to the particular local space, so it is going to involve only the genital tract. But in case if the patient is going to have something like a complement deficiency disorder, again the patient can go for dissemination, where it can cause a life-threatening condition like meningitis or encephalitis. And post-infection, like again the patient can develop something like reactive arthritis, which is called Reiter's syndrome. So it can be a chronic condition following this gonococcal infection. So again, like it's called as reactive arthritis or Reiter's syndrome. So post-infection with this particular gonococcal infection, the patient is going to experience a severe arthritis, which is going to be for a longer time. So it is going to be a chronic attack after the gonococcal infection, so which is called as Reiter's syndrome.